this past week indicates health insurance premiums for the state's marketplace exchange will be on average about 2% lower than last year. Premiums offered through the private option will decrease slightly but essentially remain flat in comparison to 2014, according to Governor Mike Beebe. This is just a slice of what's happening in the roiling health insurance markets in Arkansas and across the nation. Joining me at our political roundtable are State Senators Jonathan Dismang and David Sanders from Little Rock. Thank you both for being with me.
It was a policy roundtable, not a political round.
Politics, policy, it all works into the same thing.
No, thanks for having us.
Senator Sanders, appreciate you.
Good to be here.
So let's talk about the premium news that we got this week. It's preliminary. November is when we will actually know what real numbers are. What do you think is driving the news that these insurance premiums are going to be lower?
I think one of the big things is that we're able to, the insurance companies now have almost a year of data to look at. I think they're indicating that utilization probably hasn't been as high as they originally anticipated. And that, long term, that's a good thing. Mm-hmm. This is a relatively healthy population, and what we want to do is create some competition, and I think we've got that in play.
Senator Sanders?
Well, it is. I think it goes to the heart of the private option, and that is what is the private option? And in insurance terms, it is what is called a double underwritten group of individuals, as Senator Dismang said, that are largely healthy. That market has never existed in the history of insurance markets before, and what we have believed all along since we started this discussion, 2012, December of 2012 really was when we began in earnest. We knew that people who were in poverty or around near poverty could not only participate in insurance markets, but if done correctly, could have a positive benefit on insurance markets. And here, when you look at Arkansas within the context of the rest of the nation, and you see rates going up in other states, and in Arkansas, they're going flat would have been great. A small increase would have been great, but we're actually going down. I think that's tremendous news, and it's attributable to the private option and the strength of the policy.
Now, this is in the marketplace that you have some jurisdiction and control over in terms of policy, but in the larger insurance markets, I'm still hearing stories of people that are seeing potential premium increases. I think just the Democrat Gazette this past week, actually, their employees learned that their premiums may more than double potentially.
I'm not on the state plan. My insurance rates actually went up.
They did go
as well. So that happens, but I think the difference is in what you see here. It's a different pool. It's a different group of people.
Right.
And what you've seen nationwide, particularly in the exchanges, is you've lacked the participation of young, healthy individuals in the exchanges. What we have here is the participation of largely young, healthy individuals. Our average age is 9 years younger than any other state exchange, so that's important.
Well, let's talk about what's going on in some other states, because we've seen some movement in states like Pennsylvania this week, just made some moves. There's been some other states. What's your takeaway, Senator Dismang, on what you're seeing other states do in terms of how it compares to what Arkansas has done?
Right. And Pennsylvania was just today, so I haven't had a chance to really kind of go through and look. And I think if David was speaking earlier and was saying that it had more to do with a managed care system.
Right.
But I think what it does do, Arkansas kind of led the drive in creating some reforms inside, not just traditional Medicaid, but also the ACA, really kind of pushing the envelope and testing the boundaries. Since we were the first, several other states have come along and are continuing to push. And so what's good for us as policymakers in the state is we will be able to take a look at what's happening in the other states. We'll see what that flexibility looks like and then apply it back to ourselves. Things that make sense for Arkansas, we'll be able to apply here and utilize the same type of.
Do you see some innovation in some other states that you think, why didn't we think of that? Maybe we should take this into consideration?
Well, in reality, when we were hammering the details of this out in Senator Dismang's office, joined with several of our colleagues, we knew that when we did this, that other states would in fact follow our lead, and that the goal would be to have them innovate and to do things that made sense for their state. So it's not only the fact that Pennsylvania has come online, Tennessee's talking about it, but Utah is very close, and they're driving hard at something that I think is very important, and that is the effort to tie work readiness and health care. And I think that is very important, not in the sense that you want to be punitive, but I think one of the things that Jane English is working her tail end off on is getting our workforce system in the state aligned, because we're seeing the remanufacturing of America. I think for us, it is healthcare has been a major impediment to people being able to get ahead in terms of the holding them back and not allowing them to really move up the income level. So I think we have an obligation to connect individuals, if we're tracking and measuring, connect individuals so that they can be work ready and so they can be productive citizens. Senator Dismang's talked about it. We've seen first-time disability claims drop in our state. That's not by accident. And so if these people are in a position to work, I think we have an obligation to help them work.
At the same time, though, I mean, you still got to pay for all this, and the state is going to have to increase its tab over the years. That's been one of the biggest criticisms from members of your own party, as a matter of fact, have said there's no way to sustain this. We're adding to the federal debt. What's kind of the long-term game plan of how the state of Arkansas manages this expense when it does become much larger than it is right now?
One of the things you have to look at is the total outflow, and that's for the tax revenues that we'll be sending to the feds on their level, and then also the Medicare cuts that will, essentially remain on the federal level, and making sure that, we balance that inflow and outflow of dollars. And I think that's where the sustainability comes from, and I think in the long term, we'll actually be able to drive down cost and not be a net cost to the federal government.
Is that something you get on a piece of paper, though? I mean, is that something that you guys are going to be able to show skeptics and critics?
I mean, first things first, where you began the conversation was with the 2% drop in rates. That is a profound impact. So what you're doing is your baseline is not increasing, it's actually decreasing. And I suspect, and I would predict that in 2016, we would actually see a further reduction because of the things that we're doing, because of the proliferation of coverage, because of the fact that we're seeing, emergency department visits actually drop. Our healthcare entities are responding. We are pursuing things with payment reform where we're actually paying people correctly. We're seeing there are a lot of things that are going on in Arkansas that will actually allow us to bend that cost curve downward. And look, a lot of states have talked about this for a long time. A few states have actually been able to do it, and we're doing it in real time right now. So that when we're responsible for paying part of the bill, it's a smaller bill that we'll be responsible for paying.
All right. Let's go this way. You are also going to be considering some more innovations, I think, in the next legislative session. What's maybe out there on the horizon that people need to be aware of that's coming? I know independent savings accounts have been one, but what are some things like that?
Well, I think it's the continuation of the patient-centered medical home. I think there's been some early indications that will be a successful program. And then that goes back to it is more than just, the private option as a standalone piece. It's it's kind of it's a more universal effort that involves not just the way that we pay for health care, but how we manage the outcomes for health care. And so I think, like I said, I think healthcare independence accounts and what they'll do for consumerism, for the utilizer of healthcare is critical, but also how, like I said, some of those other programs move forward.
Policy-wise, does it matter who is the next governor of the state of Arkansas?
No, I think it does. I think it has I think for a number of reasons, and not just for this. But
you've got a Democratic governor candidate that says he's for the private option wholeheartedly, and a cautious Republican candidate.
Well, fair enough. But I think, when you ask about, what are we moving towards? And I think if you were to ask us, what is our goal at the end of the day? And that is that Arkansans are the most informed consumers of health care in the country. And what you have to do that is you have to insist on transparency and cost, transparency and quality. As Senator Dismang alluded to, the patient-centered medical home is a big part of that. But we will be doing other things that allow Arkansans to engage more and more with their health care, because if we want health care to not continue to increase, we're going to have to, we're going to have to see people behaving like consumers, and we're going to have to drive down the cost by allowing them to see more and more what they're spending their money on.
All right, we got to wrap up our on-air time, but you guys will stick around. We'll do a little extra online. You'll do that.
Absolutely.
Senator Sanders, Senator Dismang, thank you for being here. A little bit more on that online at talkbusiness.net after the show airs.
A farmer understands the needs of every season, and so do Farm Bureau members. When Arkansas families needed electricity, our members brought it. Reliable roads, our members built them. Agricultural education, our members provided. Today's members may not live on a farm, but their connections are as close as ever. So when that difficult season comes, no member has to face it alone. For every season, Arkansas Farm Bureau. Join today.
Welcome back to our Web Extra. I'm with Senator David Sanders, Senator Jonathan Dismang. We've been talking about health care policy. I want to finish up here because I didn't get my full answer on air here. Does it matter who the next governor is, Asa Hutchinson or Mike Ross? Tell me why one of them is more important to you guys than the other one.
Well, look, I mean, Jonathan and I are both Republicans, and certainly make no apology for that. And both of us support Asa Hutchinson and his bid for governor, and I think for a number of reasons. And it's not that we dislike Mike Ross. I think we've demonstrated quite well that we can work with individuals on both sides of the aisle. I really think, though, for where we want to go as a state in terms of really moving things, whether it be linkages between public assistance and work, and really using the public system to truly be something that will help achieve employment, help achieve personal responsibility, all those things. You know, I think that's certainly something that Senator Hutchinson or Congressman Hutchinson
right.
Agrees with, and I don't know that Mike Ross wouldn't, but I think we have a real opportunity here.
Your take, Senator Dismang.
Well, I mean, I think that, number one, I don't think either candidate could guarantee the passage, in particular, of the appropriation. I think largely most of the reforms, while they can have some leadership outside the legislature, are going to occur inside the legislative body. And so I'm not sure exactly that one's going to have a much stronger position than the other. I do like the fact that, Asa has kept an open mind, to the issue, and he also wants to be able to, if it does continue, he's indicated, I think, several times that, there would be alterations and changes, and I think I would most likely be supportive of what, his direction would be as far as those changes. And but like I said, I think it's still something that's going to be a battle, or, the discussion really is going to be inside the legislative body, and it'll be hard to have a lot of outside influence. Sounds
like you will have a governor either way, whoever wins, that has at least an open mind or is supportive of the private option. Yeah. Let's talk about some other things that have been making some news this week, particularly one that I know Senator Dismang's been very involved in, the Unemployment Insurance Trust Fund. That debt has been, will be eliminated by the end of this year, according to Governor Mike Beebe. You guys worked pretty hard on that. You got to be pretty satisfied that this thing is working as planned.
Yeah, and I'm really proud of the accomplishment. I was proud to be a sponsor of that legislation with Speaker Carter, and I think when you look back at things Speaker Carter have accomplished, this is going to be top of the list. But yeah, we're proud of where we were. At the time, it seemed like it was an insurmountable task, and to be honest, there wasn't a lot of folks that are willing to compromise. But we were able to hammer something out, and a few years later, we've got our bill paid, or fixed to have our bill paid, and that will allow us to make some additional tweaks and changes to the unemployment law. It kind of gets the feds off our back as far as what we do, and look forward to exploring additional possibilities.
Maybe have a little.
He's being very gracious. This guy, the Arkansans owe this guy a debt of gratitude, because I will tell you, I was a freshman in 2011, and there were a lot of people, even in the business community, saying that we need to increase that wage base. And newly minted Senator Dismang and then junior member of the legislature, Mr. Carter, said no, and we all said no, but they provided the leadership to get us there. And in fact, what they said at the time was true, is that we would pay off that debt by the end of 2014. And I will tell you, you talk to people who had advocated for the other, and they're like, man, we made the right decision.
Yeah, so that's a good deal.
Well, and employers, there's going to be some additional money in the pocketbooks, especially for some of our larger employers.
Absolutely.
It's a significant amount of money, and in a way, it's a new tax cut for us.
I was about to say, there's going to be a little bit of a surplus you guys will have to guard against some foxes in the hen house there. All right, another issue of significance, Senator Sanders, I know you were over at the Department of Environmental Quality. We just had Teresa Marks on earlier in the program talking about the new EPA rule on carbon dioxide emissions here. This rule is here to stay. It's just going to get tweaked, it appears to me, at least unless there's a legal challenge and something happens at the federal level. But in the state, they're going to have to move forward in terms of trying to make it work in some sort of state plan or regional plan. What's your takeaway from what you're hearing from the debate?
And I think for us and for the state specifically, the question is, how quickly do we embrace the rule, and do we push back? And I think that's the question I've had for a long time. And if you look at the way the rule has been proposed, And there are a significant number of unanswered questions with regard to, you know, how particular aspects of it are going to be enforced with regard to, and that we're talking about, you know, carbon emissions for the state. But then when you compound on top of that standard, you know, the ground level ozone standards and all these different things that are being pushed by the EPA, you look at the advantages that we enjoy in Arkansas for job creation, and there's one major advantage, and that is cheap utility rates.
Right.
This takes that rule, as written today, takes that advantage and destroys it. And that's unfortunate. What I would hope is that the EPA would extend the comment period, which is set to end really at the beginning of October, and that we could have a real meaningful conversation here. Because again, we are looking at a change in administration. This is not going to really affect anyone right now. We're talking about the future. And the way the rule is written currently, it's going to disproportionately affect Arkansans. And I think we have an obligation to push back, to ask questions, and to make sure that something that we're signing on to by way of a state plan isn't a path off the edge of a cliff, and right now it looks like it is.
Yeah, there's a lot of loud voices on that. Last question, in your neck of the woods over in the row crop area of your district there, big grain farmer crisis going on right now. Kind of give me a sense of where you think things are in terms of the ceiling and the floor on this.
Well, I mean, I think right now, you know, a lot of the farmers had borrowed against those funds, you know, or that future money coming from Turner from the on the federal level. And so, you know, getting a stay on that, which has been a request made by our federal delegation, I think is critical at this point. And really, I mean, I think everybody's still assessing how big this impact is. And yeah, I mean, it really impacted folks in my area across multiple counties, and I know that we've got a lot of guys that maybe not hurting today, but you know that they've not looking too bright on the horizon. So, you know, I think we just continue to have our meetings here. I mean, I think in the future there will be, you know, some regulatory changes that we'll implement on the legislative level. Hope to have that package ready by the time we get in session. But you know, you still have what has happened, and it's a big number, and it's going to have a significant impact on our farm families.
Y'all do see action being taken by the legislature.
Sure. I think
give me a specific.
Well, I think the question is really where would the regulatory function be housed? And I think logically someone would think immediately to the Ag Department, but that's really not what they do in the state of Arkansas.
Right?
So, no, they're not regulators. So I think you have to look at, you know, Securities Commission, and they're probably best set up for that. But you know, this is a huge story, and if you put it in perspective with bank failures in Arkansas history, and you talk about sort of the top and the bottom in terms of exposure. You know, when you look at that top end, $100 million, that's huge. Yeah. And when you look at the fact that, you know, these folks have borrowed against that, and there are debts that they have to pay, this is big. And you know, if it goes to a bankruptcy judge and there's an arbitration and everyone's paid out, I think our Arkansas farmers are going to, some of them will be hurt. Right. Some of them have different levels of exposure here, obviously, but for those who are really exposed, there's a lot of potential downside.
Senator David Sanders, Senator Jonathan Dismang, thank y'all for being with us.
Appreciate it.
All right. That is our Web Extra. You can keep up with the latest business and political headlines each and every day at talkbusiness.net. Thanks for watching.